Good day everyone! So for today's video, I'm going to discuss the Introduction to Special Education Part 2. Because we're having now an online class and we're required to upload our topic in YouTube so that our instructor can check easily our reports. Okay, so the first part of this introductions was discussed about what is special education, what will students learn in this topic, who is special education for, special education beliefs and attitude, and disabilities, types, causes, and prevention. So for the part 2, I will continue to discuss some of the disabilities, then rights and policies, and the last is support service. So another disabilities is the hearing impairment, and it is a severe or profound hearing loss, or it is known as deafness. Deafness is an uncommon disability in children, but many children have a mild or moderate hearing loss. We also have a pre-lingually deaf. So these are the children who are deaf before they learned language from 2 to 3 years old. So what are the causes of this pre-lingually deafness? First, exposure of the pregnant mother to German measles. Second, drugs or chemicals. Third is the cerebral palsy and some genetic condition. However, most hearing loss is caused by ear infections or injury in the early years of childhood. Mild or moderate hearing loss can be a temporary condition in many children due to ear infections, but ear infections also often lead to permanent damage. So teachers should check regularly to see whether students have developed ear problems, as ear infection can occur very quickly. So the best way to prevent ear infections or other ear damage include: first, avoid swimming or bathing in dirty water. Okay. So second is never place any object in the ear. Third is keep the outside part of the ear clean. Then avoid loud noise. Then last is always use the BBC. It means the blowing, breathing, and coughing strategy. So the blowing, breathing, coughing for healthy ears is: first, the B is blow the nose using the tissue or leaf that can be thrown in a bin, like that. Then the second is breathe in and out strongly 5 times. Third is the C, which is the cough 2 times to clear the chest. So for the teaching strategy, for the mild hearing loss, students with mild hearing loss might not be able to hear soft sounds such as whispering, or they might not be able to hear certain types of sound. For example, many children cannot hear high-frequency sounds such as some of the consonant sounds in speech. For example, letter K, S, P, and T. Students with mild hearing loss often miss many of the words spoken by their teacher and the other student, and they often miss words endings such as sticks, playing, and played, and so on. And these are the students often appear to have learning difficulties and become frustrated and upset at school as a result. So teachers need to ensure that these students are placed near the teacher, where they are most likely to see and hear most clearly. So the best and easiest way for a teacher to check a student's hearing is to say different single words in a normal, quiet voice behind the student, and ask the student to repeat the words one at a time. So if the child can repeat the words, then the child probably does not have a hearing impairment. But if the child cannot repeat the words, then the child probably does have some hearing loss that may causing other difficulties as well. So we're done with the mild hearing loss. So let's proceed to the moderate hearing loss. So students with moderate hearing loss cannot hear normal speech properly without hearing expensive hearing aid. So I once visited a school before. Then I saw a child who has a hearing impairment, and I think he is in the level of moderate hearing loss because he wears an expensive hearing aid so he cannot really hear. So Vaughn suggested the following practices for teachers to use when teaching students with mild or moderate hearing loss. So use visual cues and demonstration. So first, face the student directly when you talk. Second is use natural gesture. Third, use modeling to demonstrate how to do different procedures and tasks. And do not try to talk student while writing on the chalkboard. Then use pictures, diagrams, and graphs. Then last is use experiential learning strategies. Then to use cooperative learning strategies, so use peer tutors to assess the students. Choose clear speakers for class discussions. Then for monitoring the students' understanding, so we have asked the students to repeat important information and direction. Reward information to make it clearer. Third is provide written information as often as possible. So the third teaching strategies is the severe or profound hearing loss. So deaf students can be taught in regular classes, but the teacher will need to acquire some special skills. Deaf students need to be communicated with using a combination of clear speech and sign language, in addition to expensive use of written materials. So peer tutors and cooperative learning strategies are very useful for assessing these students, especially if the students' classmates have learned some sign language. So one of the special skills that the teachers would learn is the sign language, especially if the student has a severe or profound hearing loss. They cannot really hear or understand what you say. So much better if you also know a sign language for them to understand more about what you are trying to say to them. So next, disabilities is the speech impairment. So children can have communication problems for a variety of reasons. In many cases, a communication problem is the result of another disability, such as intellectual disabilities, severe learning difficulties, physical disabilities, for example, the cerebral palsy, cleft lip or palate, like that. So deafness or moderate hearing loss, or an emotional or psychological disorder. In other cases, and for no obvious reason, children have difficulty learning, understanding, and expressing language. So there are three types of communication problems. First is the expressive problems. Okay, so expressive problems are the most obvious communication problems. Children may be unable to sequence sentences properly, so they use incorrect word or a grammar, or just speak in other word sentences. So children may have articulation problems where they cannot physically produce certain sounds or words, or where they stutter. Some children speaks too softly or too loud, and others speaks in monotone without using expressions. So second is the problems with interacting. So some children lack good social and conversational skills. They don't know how to take turns when talking. They don't know how to begin or end a conversation, or they might not make eye contact or use appropriate body language. Some children also cannot pick up subtle expressions and emphasis in language. So these are the children, their lack of good socializations and conversational skills. So these are the students who are who don't know how to begin when they're having a conversation with somebody. They don't know how to begin, or sometimes they don't know how to end a conversation. Even they don't have eye contact to the person they are talking to. So third is the receptive problems. So these are the difficulties with the comprehension and understanding of spoken language. Receptive problems are less obvious than other speech problems and more difficult to identify than other problems. Nevertheless, they can have serious consequences for children learning and development. Children with receptive problems struggles with the meaning of words and the meaning of sentences. They often have difficulty with the subtleties of language and with abstract concepts. They can have problems making predictions and inference in language. Sometimes they appear to have appropriate expressive skills, but this is often just meaningless chatter. So what are the teaching strategies in teaching a speech impairment? So children have no speech at all or whose speech is unintelligible may need to use a sign language or pictorial communication system. Others may need a properly designed speech therapy program. So, teachers are most effective in teaching students with communication problems when they first provide individual assistance in a kindly way. Next is check students' understanding regularly. Provide all students with memory games, rhyming games, communication games, and other word games frequently. Next is encourage students to observe each other making sound and ask students to feel their own mouths as they make letter sounds, words, and other sounds. Encourage mouth and tongue exercises such as blowing bubbles, blowing paper balls, coughing, yawning, and opening the mouth very wide. Moving the tongue about, sticking it in and out. So I think one of this example is the tongue twister. So next is encourage and praise all attempts at speech and improvements. Never make fun of or mimic a student's speech. Never force a child with a speech problem to speak in front of the class. Always respect students' dignity. Always allow time for students to finish sentences. Provide as many communication activities as possible. Do not correct students' speech all the time, but instead target one sound or skill to work on over a period of time. And lastly is encourage speech practice and exercises at home. So next disabilities is the vision impairment. So vision plays a vital role in school learning, and it is essential that the teachers understand the visual abilities of their students. So many students who have mild or moderate vision impairments are not identified as such, so teachers have an important role in detecting vision impairment. So as is the case with hearing impairment and some other disabilities, so students with vision impairment can sometimes be mistaken for students with intellectual disabilities or learning difficulties. So when the teacher finds that a student is struggling at school, they should always check the student's vision and hearing. When vision impairment is not addressed at school, it can lead to learning difficulties and even behavioral problems, as a student misses important information, struggling to keep up with other students, loses confidence and becomes frustrated. So what are the causes and treatments of visual impairment? So we have the eye conditions. So these are the problems of the eyes. Then observable effects and the management at schools. So first, we have the cortical visual impairment. So eyes appear normal, but there is damage to the nervous system that the brain uses to process visual information. CVI is caused by brain damage. So this is one of the problems of the eyes. The cortical vision impairment. Then the observable effect is often occurs with other disabilities, for example, the cerebral palsy, very low or no vision, problems making sense of visual information. So what is the school management do? Use clear and simple objects and colors to try to teach visual recognition. Use other senses, touch, hearing, for teaching and communication. So next is the dry eyes, also called xerophthalmia or keratoconus, a vitamin A deficiency resulting from malnutrition. The eye becomes very dry and the cornea softens and forms ulcers. So the observable effects is the night blindness and gradual loss of vision. The white part of the eye becomes dull and wrinkles. The cornea may buckle and burst, causing blindness. The condition is reversible in its early stage. Then the management at school is leafy vegetables and vitamin E supplements can reverse the condition. So we need to eat leafy vegetables and vitamin E supplements. So one of the vegetables also I know which is good for the eyes is the squash. So the third is glaucoma. This is one of the eye problems. So glaucoma is a high pressure inside the eyeball. Eye becomes enlarged and blindness can occur. So the observable effects is fluctuating vision loss, oversensitivity to light, loss of visual field. Glaucoma can be stopped with medicine. Then management at the school. Children with glaucoma experience pain with worsen during times of stress. My mother has a glaucoma and she suffered the pain, and now she is taking a medicine, and hopefully someday the glaucoma will be treated. So next is the myopia, loss of visions in half the visual field of each eye. Okay, so loss of visual field, students scans a lot. Conditions can be helped with surgery and medicine. If not corrected, reading ability and other schools activities can be seriously affected. So teaching scanning skills, use clearly markers at the beginning and end of the sentences, and to mark other important visual informations. That's the management at school. So next is the hypermetropia. So this is the long-sightedness. So I have a classmate before. She is far-sighted. So the observable effect is eye strain when reading glasses are needed. So yes, she wears eyeglasses. Maybe this is one of the best ways for us students to wear eyeglasses. So the management at school is no special management is needed if the child wears glasses. So next is the keratoconus. This is the cornea becomes cone shaped. So the observable effect is the decreased distance vision in both eyes. Vision is distorted, can be corrected with glasses, but in some cases a corneal transplant is needed. Then the management of school is avoid heavy contact sports, avoid glare, like that. Okay, next is macular disease. What is macular disease? So this is the degeneration of the central part of retina. The observable effects is loss of clear vision and extremely short-sightedness, oversensitivity to light, loss of color vision, tinted glasses, and very strong glasses for distance viewing can help. Okay. So the management at school is students need to sit close to the chalkboard. Visual information needs to be very clear and well marked. So that is macular disease, and still need a very strong eyeglasses. And next is the myopia. So this is the short-sightedness, and the observable effect is the blurry distant vision. Glasses are needed. And the management at school is no special management is needed if the child wears glasses. Very clear materials needed to be provided if glasses are not worn. So next is Nystagmus. So what is Nystagmus? So it is a rapid involuntary eye movement. The observable effects is uncomfortable visions, which worsen at times of stress. And the management at school is provide shorter visual tasks, allow the child to position themselves comfortably. So if the student has a nystagmus, the child must be placed in a comfortable position in the room or in the school. So next is the optic atrophy. So what is optic atrophy? So this is the degeneration of the optic nerve. Okay, degeneration of the optic nerve. So the observable effect is the fluctuating vision loss, very strong glasses needed for close and distant viewing. When you have a optic atrophy, you need to have very strong eyeglasses, means high graded eyeglasses, in order for you to see whether you are close or in a distance viewing. So the management at school is larger, clearer printed materials. So visual information needs to be very clear and well marked. So if you have a students like this, so as a teachers, we need to use a very clear and a larger visual materials in order for the students to see clearly. Next is optic nerve hypoplasia. So this is the small undeveloped optic nerve. The observable effects is decreased vision depending on severity of the condition. Very strong glasses are needed for close and distant viewing. So this is the same with the optic atrophy. They also need a very strong graded, very high graded eyeglasses in order for the student to see whether it is close or in a distance viewing. For the management at school, it also needs a larger, clearer printed materials. Visual information needs to be very clear and well marked. So the same as the optic atrophy. So we cannot deny that there are students who has eye problems. So we need to consider their situation. Okay, so next is the retinal detachment. So what is retinal detachment? So this is the detachment of the retina from head, injuring or other conditions. So the observable effects is the partial or total loss of sight. Surgery can correct the condition. Very strong glasses can help. So the management of schools is avoid contact sports, use bright lighting for reading and other visual activities. So next is the retinitis pigmentosa. So this is the progression, degeneration of the retina. So the observable effect is the loss of peripheral vision, loss of vision in unlit places, tunnel vision, oversensitivity to light. The management at school is the restricted mobility in unfamiliar places, encourage scanning, caution needs to be taken in darker places. So next is the retinoblastoma. So it is a tumor of the retina. So the observable effects is the depth perception is affected if one eye is removed. Central or peripheral vision lost depending on the position of the tumor. The management at school is if the student has lost an eye, position the child where they can best see the chalkboard. So next is the retinopathy of prematurity. So this is the scars of the retina in very premature babies. So the observable effects is the loss of vision or blindness, short-sightedness, and glaucoma. Surgery may help. So the management at school is use large print materials, encourage use of remaining visions, assist with mobility in unfamiliar places. So next is the strabismus. So this is the muscle weakness causing turned in eye. So the observable effect is the affects hand-eye coordination and depth perception. Surgery or corrective glasses may help. So the management at school is allow extra time for visual tasks. Okay, so you need to have an extra time to do a task. The next is Toxoplasmosis. So this is one of the eye problems, Toxoplasmosis. So this is the inflammation and scarring of the retina. Okay, so the observable effects is the loss of central or peripheral vision blind spots. Management at school, use large print materials and clearly marked visual materials. Actually, if we have a student who has an eye problem, so we need to have a larger visual so that the students can see the visual clearly. So next is the trachoma. So trachoma is an infection of the eyelids and cornea, usually resulting from poor hygiene, can also be spread by flies. So the observable effects, irritation and inflammation of the eyes, small lumps under the eyelids, and partially cloudy cornea. Antibiotics can stop trachoma, but good hygiene is the best prevention. Okay, so the management at school, ensure that students and parents adopt good hygiene practices, keeping eyes and faces clean. We only need to have a good hygiene practices and keep eyes and faces clean. So as a general rule, students with vision impairments need clear, well-marked visual materials, like for example the diagrams with important information highlighted or with arrows marking relevant parts. Large, clear print in reading materials and good lighting. Teachers should also ensure that the classroom is kept free hazard and that chairs, desks, and so on are not moved around all the time. This is to ensure that the student with very low vision do not trip or stumble but rather can learn the layout of their classrooms. Teachers should also compensate for students' low visions by using more spoken information and asking other students to help students with vision impairments with their work. As you can see, this boy, a blind boy using a braille typing machine. Braille is a system of raising dots on paper that blind people can use to read. In this picture, the boy is typing with his right hand and reading with his left hand. So how to prevent these types of vision impairments? So many types of vision impairments are inherited and cannot be prevented. However, some vision impairments can be prevented as follows. Okay, first is students need to be educated to never throw stones, sticks, and other small or sharp objects at other children. Next is students need to be educated about keeping chemicals such as lime, cement, petrol, and cleaning products away from their hands and eyes. Next is students and parents need to be educated about hygiene, especially keeping eyes, faces, and hands clean. So we will teach our students to have a proper hygiene. Next is eyes should only be cleaned with clean water. No chemicals should be placed in or near the eye. Next is children should always be taken to a health clinic if they have any kind of eye problems or irritation. So next is children and mothers need a diet that is rich in vitamin A. The best foods for vitamin A are leafy vegetables, cassava, pawpaw, and other yellow and orange vegetables. Just what I said earlier, the squash is very helpful for the eyes. The leafy vegetables and other yellow and orange vegetables. So next is girls should be vaccinated against rubella. So this is a German measles. So that's the end of the topic about vision impairment. So let's proceed now for the behavioral and emotional disorder. So behavior disorders are regarded as those behaviors that students sometimes exhibit that are inappropriate and unacceptable in the classroom or school. Sometimes students exhibit inappropriate behavior because of emotional disorders, but it is often possible to determine whether or not a student's behavior is actually caused by an emotional disorder. So what are the causes of this behavior? So there are many reasons why students have behavioral and emotional disorders, and it can be very difficult to identify a specific cause. Some causes can be dealt with a change, but others cannot be resolved by the teachers. So these are some typical causes. So first is the home and community factors. So difficult or abusive home environment, conflicts at home, inconsistent management at home, lack of sleep, and the lack of attention, love, or care. So this will happen to some students who experience in their homes like lack of attention, love, or care from their parents. So that's why some of them will do some behavioral disorder in the classroom. The second factor is the school factors. So this is the disorganized teacher or teaching, the unfair school discipline practices, conflict with other students, difficult or confusing schoolwork, boring schoolwork, intolerant teacher, poor relationship between school and home. So next is the student factors. So this is the low confidence and poor self-esteem. So lastly is the lack of interest. So this will happen to students if they have also issues at home. So first is the learning difficulties. They cannot really catch up the lessons from the teachers. Unidentified disabilities like hearing or vision impairment, headaches, and other illness. Poor training in social skills, mental illness, need for attention. So these are the things that will happen to a student or to a child when they have a lack of interest. So what are the teaching strategies should the teacher apply when they are having a child who has a behavioral disorder? First is effective, interesting, organized teaching. So students are much less likely to misbehave when the teachers make sure that all teaching is understood, teachers in a way that is interesting, and treat students nicely. Okay. So second is ignoring poor behavior. So ignoring misbehavior doesn't always make the behavior go away, but it very often does. Teachers should try this strategy if they think that the student is behaving badly just to get attention. So sometimes we as a teachers, we will ignore those misbehaved students just to get attention. So third is rewarding good behavior. So this is praising and giving privilege for good behavior is a very effective strategy that works most of the time. It can be hard to reward a very naughty child, but if you catch them being good and reward their good behavior, you can replace their bad behavior with good behavior. So I already experienced this kind of strategy. So this is one of the best strategy to catch their attention. You do praising and giving privilege for those students who behave well. So next is the time out. Removing the student from the classroom or playground for a few minutes, or just giving the student a few minutes to cool off, can be an effective response to very disturbing or aggressive behavior. Okay. So next is the punishment. Taking privileges away. Reprimanding, scolding, and giving extra jobs can also be very effective ways to reduce poor behavior. Punishment should always be combined with rewards, however, so that the student is taught what to do as well as what not to do. The aim is always to replace poor behavior with good behavior. Next is the talking and investigating. So students behave best when they know that their teachers cares about them. By taking with students and find out why they are misbehaving or not working effectively. Teachers can help students solve their problems and improve their behavior. So this is particularly important for students who are very quiet, shy, or who lack confidence. So next is being consistent. So teachers who are consistent in dealing with misbehavior and who don't let their emotions govern their actions are more effective in encouraging better discipline. Being consistent is essential for good behavior management. So our next topic is about rights and policies. A fundamental principle of the Constitution of Papua New Guinea is the right to equal opportunity for all citizens of PNG. In 1993, the government of PNG and the National Department of Education formulated and implemented a National Special Education Policy, PNG Department of Education, in 1993, that declared three foundations underlying the development of special education in PNG for the current era. In essence, these foundations are: first, children with disabilities should have the same right of access to education as other children. Second is, the government of Papua New Guinea and the National Department of Education should allocate an equitable proportion of resources, provide special education teacher training, and provide specialist teachers to support the education of students with special needs. And the last is, the students with disabilities should attend regular schools along with students without disabilities, in all cases where that is feasible. So let's proceed to the rights of individuals. So Papua New Guinea is a country that is made of a huge variety of rich and highly varied cultures. PNG is immensely proud of its cultural diversity, and the individual differences of each cultural group are celebrated frequently and prominently. The Constitution of Papua New Guinea emphasizes the individuality of each person and their community, declaring that respect for the dignity of the individual and community interdependence are basic principles of our society, and that regard with our lives, our national identity, integrity, and self-respect. While this acknowledgement of individual rights and the dignity is clearly intended in the PNG Constitution to extend to all people with disabilities in PNG, not all individuals, communities, and organizations in PNG have yet responded fully to this benevolent view. It is clear that, for one reason or another, many children with significant disabilities in PNG still do not attend school. Examination of most cultures throughout the world reveals a history of people with disabilities being denied access to the opportunities that people with disabilities have usually been able to take for granted. During the 20th century, most developed nations introduced extensive social services such as universal education and health system, and measures to reduce poverty and hunger. These nations typically responded to the needs of people with disabilities by targeting their disabilities. Many very significant breakthroughs in treatment of disabilities and medical prevention of disability occurred throughout the 20th century. One consequence of the growth in social services that occurred in developed countries during the 20th century was the construction of special facilities for people with disabilities. In the current era, authors and practitioners tend to be critical of the segregation of people with disabilities into special institutions and students with special needs into special schools and special classes. Such practices have been called society's attempt to get people with disabilities out of sight and out of mind. Even though the original intentions were usually benevolent, people with disabilities, special educators, rehabilitation workers, and others who work with people with disabilities now reject segregated models of treatment and care in disability. They argue that there needs to be a balance between appropriate care and freedom. Modern practitioners use the principles of normalization to guide the design and establishment of new systems and facilities. The principle of normalization expresses the belief that people with disabilities are entitled to live as normal a lifestyle as possible in their community, and that all special services should be aimed at achievement of this outcome. The principle of normalization does not imply that people with disabilities should not receive special services or treatment. Rather, it implies that special services should never restrict access to freedom, independence, and normal lifestyle, but that they should always be aimed at opening up opportunities for people with disabilities to gain access to all of the opportunities that people without disabilities have. A typical example of how governments have responded to the principle of normalization and increased advocacy on part of the people with disabilities is the Australian government's Statement of Directions for Services for People with Disabilities, announced in 1985, the Australian Commonwealth Office of Disability. This statement declared 7 principles to guide improvement of services for people with disabilities. Number 1 is people with disabilities are individuals who have the right to respect human worth and dignity. Number 2, whatever the origin, nature, type, or degree of their disability, people with disabilities have the same fundamental rights as all other members of the society. People with disabilities should have the same rights to privacy, social justice, freedom of choice, freedom of expression, and all other human rights that members of a free and democratic society should expect. Number 3, every person with a disability has the same rights as other members of society to realize their individual capacity for physical, social, emotional, and intellectual development. Children with disabilities have the same right to take risks, make mistakes, have restriction and protection gradually removed, and to participate fully in community activities as other children. Overprotection restricts opportunities, increases dependence, and keeps alive the attitude that they would be in danger if allowed to face the challenges of life. Number 4, people with disabilities have the same right as other members of society to services which will support attainment of an acceptable quality of life. So number 5, people with disabilities have the same right as other members of society to participate in the decisions that affect their lives. So it is often assumed that people with disabilities, especially intellectual disability, are not capable of making decisions and that they should be protected from mistakes and risks. The assumption is wrong. People with disabilities need to be taught how to make decisions and express choices and supported to make such decisions. Number 6, people with disabilities have the same right as other members of society to the least restrictive services that are available. So people with disabilities should not have their freedoms restricted by too much support or too little support. For example, a child should not be placed in a special school or class if they can be supported in a regular school or class. On the other hand, a child should not have their education restricted by not being allowed to attend school. And lastly, number 7, people with disabilities have the same right to protest or complain about services as any other member of society. So sometimes people resent people with disabilities complaining about inappropriate treatment, saying that they should be grateful that they get any support at all. In fact, all members of society have the right to expect services to be satisfactory and to complain if they are not. People with disabilities should appreciate satisfactory services and complain about unsatisfactory services, just like other members of society. So let's proceed with the inclusive education policy of Papua New Guinea. The Constitution of Papua New Guinea reflects principles of social justice and equity, declaring that respect for the dignity of the individual and community interdependence are basic principles of our society. The government of PNG has extended the fundamental principle of equal opportunity into the realm of special education. So the National Department of Education, Special Education Policy and Guidelines declare their following goals. First is the Constitution upholds the right of every child to basic education. Therefore, the state will promote equality of access to relevant, quality education for all students. Second is, children with special needs have a right to an educational program suitable to their needs. Special education shall aim to develop the maximum potential of every child with special needs, enabling self-reliance and full and happy life as far as possible in an integrated setting in the company of a normal range of children of the community. Third is the specific objectives of special education shall be the development of learning competencies and the nurturing of values, which will help learners with special needs to become useful and effective members of society. Fourth is the long-term goal of special education shall be integration or mainstreaming of children with special needs into the normal school system and into the community. And lastly is to promote the above goals and objectives. Special education needs shall be included in all forward educational planning. So the PNG's special education policy is not just a general statement of intent. It contains a substantial amount of detailed practical information and objectives, which serve to guide implementation of the policy. So these are: first is the definition and scope. The policy covers all students with disabilities, physical, intellectual, and behavioral or sensory, who require educational modifications. It does not extend to students who are gifted. The policy applies to all levels of education in PNG, including higher education. Second is the teacher preparation. All pre-service teacher training should include training in special education. In-service training in special education will be made available through special education resource centers, teachers, colleges, and provincial education offices. All teachers will be expected to attend in-service training in special education. Special education resource centers will support teachers and schools in the delivery of special education. Another is the Special Education Resource Centers. Special Education Resource Centers will support schools in integration, inclusion, and general special education requirements. Special Education Resource Centers will replace their previous role as separate special schools with their new role in supporting schools and communities. Provincial education offices will form teams to support schools in special education. Next is the assessment of children. Schools will conduct screening and other assessment procedures to identify students with special educational needs with the assistance of Special Education Resource Center personnel. Another is enrollment and organization. Special educational assistance will commence as early as possible. All schools will enroll children and youth with special educational needs. While some students may attend bridging programs in special classes or special education resource centers, all children should live with their families and attend their local school. A maximum of 3 students with a severe disability may be enrolled in any one class at a time. Promotion of students with disabilities should follow the promotion policy for all students unless special circumstances prevent this. Next is the curriculum and instruction. Students with special needs will usually follow the regular curriculum. Instruction will always be modified to accommodate students with special needs. Students will follow a modified or alternative curriculum only when absolutely necessary for the student's development. And lastly is the administration and funding. School funding, design of new school buildings, provincial and national developments in education, Collaboration between government, departments, and other agencies and school administration must support the implementation of special education policy in all aspects. And now let's proceed with the benefits of inclusion. Papua New Guinea is a large country with a high proportion of schools distributed across remote areas. The only way that PNG can provide special education support on an equitable basis to students across the nation is by adopting an inclusive education policy, by supporting schools to all deliver special education, and by expecting all schools to fulfill this obligation. Most students with disabilities in PNG can gain some assistance. PNG's inclusive education policy does not abandon all segregated options. It is intended that special education resource centers will continue to provide special classes as some students with disabilities bridge between home and school, and it is accepted that a very few students with the most severe disabilities will not attend regular schools. It is also intended that in some exceptional cases, special classes will need to be established in regular schools to serve the needs of students from several other school areas. So these are the potential benefits of an inclusive special education policy. First is the travel time and cost are reduced as students attend their local school. Next is social and cultural ties are strengthened as students attend schools with the students from their own local community. Number 3 is students with disabilities learn important life skills by interacting and communicating with students without disabilities that help them as they grow up in their community. Number 4 is students without disabilities learn how to relate to students with disabilities and become more knowledgeable about them. Number 5 is students without disabilities gain status and skills when asked to assist students with disabilities. Number 6, students with disabilities learn a greater variety of academic skills by being in a regular class instead of the narrower curriculum of a special class. Number 7, students with disabilities are better able to develop as a whole person in a regular school instead of in a special school where their disability is focused on and emphasized. Number 8, by teaching students with disabilities, teachers become more skilled in adapting their instruction to meet different needs and are able to better meet the needs of more students. Number 9, regular schools have higher expectations of academic performance and behavior than is the case in special schools, leading to higher levels of performance in students with disabilities. Number 10, communities learn to be more accepting and tolerant of disability and other differences and become proud of the achievements that their members with disabilities, with the help of the community, make. So that would be all about rights and policies, and now let's proceed with our next topic. It's about support and services. So under the inclusive special education policy of Papua New Guinea, children with disabilities and other special educational needs are expected to attend their local regular schools at all levels of education, like elementary, primary, and high school. So for the rationale, inclusive special education is the only practical model for most students with mild disabilities. Inclusive education generally offers many benefits to teachers and students. Inclusive education is probably the only practical model for Papua New Guinea, in any case due to the unique geographical circumstances of PNG. Nevertheless, inclusive education is challenging and demanding, and most teachers find it difficult from time to time. Schools and teachers are able to deliver inclusive special education much more easily and effectively if they receive additional support. In PNG, support is available to many schools through special education resource centers. Teachers need to learn how to access and best utilize the resources and personnel offered by the resource centers. So let's proceed with the service providers. So these are the services available to communities and schools in Papua New Guinea, include government departments, namely the Department of Education, Health and Social Welfare, and non-government agencies such as Kalan Services, Red Cross, St. John Association for the Blind, and some independent agencies that utilize funding from international sources such as Christoffel Blinden Mission and Friends of the Disabled Association or FUDA. In the year 2002, there are 11 special education resource centers with a total of 43 Indo or National Department of Education funded teaching staff. The centers have about the same number of other staff who provide community-based rehabilitation and other services to their communities. While National Department of Education also assists provincial education offices and their delivery of additional special education support. The Special Education Resource Centers are the major service funded by National Department of Education, and they are the major special education service providers to school in PNG. They also have the Kalan Services. So the Kalan Services is the largest non-government special education and community-based rehabilitation provider, supporting schools and communities through its special education resource centers in Wewak, Mount Hagen, Goroka, Rabol, Kionga, Boka, and Mendi. So the National Department of Education Special Education Unit also provides administrative, teacher staffing, and resource support to special education resource centers, assist in Indo curriculum development, and assist teachers, colleges, elementary training and secondary teacher training institutions, in pre-service and in-service training in special education. The unit also supports provincial education offices in development of support services and in-service teacher training activities. So let's proceed with the provincial education offices. So it is envisaged in the National Special Education Plan, the National Department of Education in 1993, that provincial offices of the National Department of Education will develop special education teams to support the schools of each province. Provincial offices will work collaboratively with special education resource centers, and it is also envisaged that each province will have a special education resource center. In 2002, there are resource centers in 10 provinces. Some provincial offices have employed additional personnel to work in schools as special support teachers. For example, the Morob province, or to administer and develop special education within the province. Another example is Manus province and Inga province. Most provincial offices are already involved in special education in-service training of teachers, and many provinces have funded school or resource centers personnel to attend specialist courses in special education. So they also have the special education resource centers. In 2002, there are 11 special education resource centers in 10 provinces. All centers were established by non-government organizations. Some centers have evolved into resource centers from a previous role as a special school, but the newer resource centers have been developed specifically as special education resource centers and community-based rehabilitation centers. All centers provide clinical services, and all centers provide direct support to schools. Some centers continue to operate segregated classes, but this model is increasingly regarded as temporary, bridging arrangement to prepare students for school. All centers provide support to children whose disabilities prevent them from attending school. These services are called community-based rehabilitation and usually involve provision of therapy, medical or clinical support, advice and guidance for parents and communities, and awareness raising. So the teaching staff in special education resource centers are funded by the National Department of Education. Other center staff are funded by non-government agencies, and the buildings and other services are also provided by non-government agencies. Consequently, the centers are jointly managed by non-government agencies and the Department of Education. The shared management arrangement works efficiently, and in all centers, the National Department of Education staff and the non-National Department of Education staff share their workloads to some extent. So these are the roles of special education resource centers. First is to develop and deliver special education support to individual students and their teachers through materials and program development, program training and monitoring, and direct support to the student's teacher. Second is to develop and deliver in-service special education programs and materials for schools and teachers. Third is to assist schools through training and demonstration to conduct screening and assessment procedures to identify students with special educational needs. So, special education resource centers should only engage in medical screening activities where hospital, clinic, or other medical services are unavailable. And special education resource centers should also ensure that screening activities are always tied directly to follow-up support or interim measures if follow-up support is not immediately available. Fourth is to establish early intervention and or homeschool bridging programs for children and youths with special educational needs. Number 5 is to provide home-based or center-based educational and vocational education programs for children and youths with very severe disabilities who cannot attend schools. Number 6 is to assist schools with establishment and development of integrated special education resource services, for example, the Integrated Deaf Unit, School Resource Teacher. Number 7 is to provide educational assistance to students who are long-term patients in hospital. Number 8 is to liaise with the Measurement Services Unit, National Department of Education in relation to the national examination preparation for students with special needs enrolled in regular schools. Number 9 is to arrange referrals to hospital or other clinical services for children and youths who require medical assessment, diagnosis, therapy, treatment, or other medical services. Next is to assist teacher training institutions with teacher training through identification and introduction to inclusive special education practicum sites or services, and provision of specialist advice to lecturers and trainee teachers. 11 is to ensure ongoing professional development of special education resource center personnel. Number 12, to conduct and participate in action research and ongoing service evaluation. And lastly, number 13, to network with other services and agencies with implications for education and welfare of students with special needs and special education resource center personnel. So now let's proceed to the rules of INDO, or the National Department of Education. Funded teachers in special education resource centers are: first is to develop and implement inclusive special education programs and materials to individual students and their teachers through assisting the teacher with individualized education from IEP development, assisting the teacher with materials development, trailing and demonstrating IEP implementation, assisting the teacher to assume IEP implementation, and assisting the teacher and school with program monitoring. Second is to develop and deliver in-service special education programs and materials for schools and teachers. Third is to assist schools through training and demonstration to conduct screening and assessment procedures to identify students with special education needs. Fourth is to design and implement early intervention and or home-to-school bridging programs for children and youths with very severe disabilities. Fifth is to design and implement home-based or center-based educational and vocational educational programs for children and youths with very severe disabilities who cannot attend schools. Sixth is to provide educational assistance to students who are long-term patients in hospital. Seventh is to liaise with the Measurement Services Unit, National Department of Education in relation to national examination preparations for students with special needs enrolled in regular schools. 8 is to arrange referrals to hospital or other clinical services for children and youths who require medical assessment, diagnosis, therapy, treatment, or other medical services. Next is to assist teacher training institutions with teacher training through identification and introduction to inclusive special education practicum sites or services, and provision of specialist advice to lecturers and trainee teachers. 10 is to engage in ongoing professional and career development. And lastly is to support the Special Education Resource Center in its general services to schools and communities by working collaboratively with community-based rehabilitation workers and other Special Education Resource Center personnel, and engaging in all quality improvement activities. And for the Special Education Resource Centers, these are the Red Cross Special Education Resource Center, St. John Association for the Blind, Morob's Special Education Resource Center, Madang Creative Self-Help Center, Kalan Services, Mount Zion Center for the Blind, Kalan Services We Walk, Kalan Services Rabol, Kalan Services Mount Hajin, Kalan Services Kionga, Kalan Services Buka, and Kalan Services Mendi. So let's proceed with the assessing and utilizing support. The school and the teacher are responsible for the education and welfare of each student with disability. School may seek assistance from the local Special Education Resource Center. Once a student has been identified as requiring special support and it has been decided that support from the Special Education Resource Center is also required, there are a number of steps that the teacher should take. First, ask the principal to seek assistance from the Special Education Resource Center and to ask the student's parent to agree to this step being taken. Second is investigate all other resources that may be available, such as other students to help, parents, other community members, and colleague teachers. Third is once resource center support arrives, ask the resource center teacher to assess the student. When assessment is complete, ask the resource center teacher to advise on what needs to be done with the student. Fourth is ask the resource center teacher to demonstrate any special techniques or instructional requirements and to show how special equipment or materials can be made or obtained. Number 5 is work out a plan for the student with the resource center teacher and the student's parents. The plan should list the main targets and any special actions that will be taken. The plan should include the role of the resource center teacher. Number 6 is ask the resource center teacher to demonstrate any special techniques until they are familiar and understood. This may take a few weeks. Number 7 is ask the resource center teacher to check the student's progress from time to time. A check during each school term will be adequate in most cases, but some students will require much more input from the resource center teacher. And lastly, number 8, review the student's plan with the parents and the resource center teacher at least twice a year. So those are the part 2 of the introduction to special education. So we understand that there are some children who has a physical disabilities, and we learned some of the teaching strategies that we are going to apply somehow. We also learned that some of the children who has a behavioral and emotional disorder, the rights and policies, and the sports services. So that's the end of my report. I hope you learned, and see you in my next video.